To be clear, the worst days are still ahead.
From the nation's most populous state, dire warnings of what's to come. From its health agency,
we see cases doubling every 3 to 4 days,
to its biggest cities.
We could have a scenario similar to the one that is playing out in New York.
California preparing for the same pandemic spread as New York as coronavirus testing expands. Despite being the first state to order its 40 million residents to stay at home, California has lagged behind New York in testing, a state that's half its size.
The system in terms of testing for COVID-19 has proven to be, at a state level, very disorganized and very unpredictable. And I would say that reflects what's going on federally.
UC San Francisco Chief of Emergency Medicine Maria Raven says private, public, and for-profit labs are fighting to get limited tests. Without one set of rules to work under, it's like the state is flying blind.
We must focus on meeting this health crisis.
California's governor announced the state had tripled the number of coronavirus tests to try and catch up to the reality on the ground.
Patients are frustrated and they're scared.
Still, Northridge Hospital emergency room nurse Alyssa Rill says California's healthcare workers have to pick and choose who is sick enough to get tested. Rill, suffering from coronavirus symptoms herself, has now been quarantined.
Do you believe that you have turned away people who have coronavirus, who could not get tested?
Absolutely. Absolutely. We've seen so many patients that have the classic symptoms, but they're still relatively healthy at that moment, and we just don't have the capability to test them. So we just have to tell them to assume they do and then send them home.
You have a cough?
Yes, I have a cough. I have shortness of breath.
Among those rejected for a test, Gloria Bossi, mother of 4 in Northern California. Bossi's sister is also sick with the same symptoms.
She was tested because she's in the dental field. She's a hygienist, and she still hasn't gotten her results. I think there's much more sick people than we're aware of. It's kind of scary. I'm petrified. It's scary because you see some people that are going to the doctor, and by the time they're actually taking them and getting admitted, that it's too late.
To be clear, the worst day